This is the Ossur Unloader brace, and it is used for any patients that are suffering from medial knee pain or lateral knee pain, specifically patients that have arthritis, or some cases you can use for medial meniscal tears, lateral meniscal tears. So the main goal of this brace is to offload the knee and allow it to move in a better way. The main target for us is to reduce down pain and start to improve patients' quality of life and get them back to a level of function that they may not have been able to do before they've had the brace. The brace itself is evidence-based, so there's a lot of research that went into designing this brace to ensure that it does what it says on the tin, in that it is getting rid of pain. Patients that we see it working are patients, for example, who have had struggles with getting back up walking, up hills, going hill walking, playing sport. They're having great success with this brace because it's allowing them to return to that level of activity with the use of a simple brace. Whereas they may have had I struggled with getting back to those targets with physio alone, where they just aren't able to get through that pain barrier. Whereas the brace, because of its 3-point system and how it works, is that it takes load away from the affected area and allows them to move fluidly. The patients that are coming in will have been told that. They'll have been told you probably need a knee replacement in future. And they're given a few options. They're given, right, you have the option of physio, you have the option of injections, and then there's the option of surgery. But the one that is kind of being missed out is the option to use bracing. Patients who try physio and fail often go get an injection, then injection, it is that jump on to surgery. And it is a big thing in someone's life if they need to go for surgery. We want to try and avoid that. And with this, there is good research out there that shows that this brace does reduce down that need for surgery if it's prolonged use. So if you were told, I'm going to use this brace for 3 months to a year regularly and it reduces your need to surgery, you're probably going to want to try out this brace, because it's, rather than going through that whole surgical process, going under anesthesia, being quite nervous about having to go for a joint replacement surgery, it's definitely a good option to think about. Usually if a patient's coming in and they're trying physio and they aren't having great results with it, or they're feeling that it's a bit of a struggle, they're still getting pain and flare-ups, we can say, right, let's try out some bracing along with it, because essentially what it does is it shifts the pressure away from that painful area in the knee. So then when they're doing a movement pattern, so say it's a squat, they're not putting pressure onto that area of the knee and causing the symptoms to develop. So then once we get them in the brace, we say, right, now we need to start getting you strong or start doing exercise in the gym to get you in a crude kind of way. It's better alignment in the knee, that we're trying to get them to move in a better alignment pattern so that it takes the pressure away from it. So it allows you to get back into exercise that might have been tougher before using the brace, but because it's shifting that pressure away from it, it allows you to get on to those next steps of physio. That might be going from a body weight squat to a weighted squat, or going up and down the stairs without pain. If anyone's out there watching this and they have a diagnosis of knee osteoarthritis, and that could be one side, so the lateral or medial compartment, or if they have a medial meniscal tear or lateral meniscal tear that is not settling down, a brace is definitely an option worth pursuing, because it's low cost in the general scheme of things, that it can really improve your levels of pain and improve your quality of life.